today. We will not tackle PPEs and cleaning, and we will not tackle shipment and storing of the sample. Second step is ethics. Remember, work ethics and principle. Before taking a sample from the patient, you should introduce yourself. Do not touch the patient's face until you take his or her permission. Explain what you are going to do, and also explain that there may be some discomfort while you are taking the sample. Be kind and objective. Patient may be anxious and panicking, so you need to reassure and calm the patient. Usually the patients are febrile, complaining of hypoxia, and they are usually are not in their normal state, so you need to reassure them and calm them down. Step 3, encourage the patient to blow his or her nose to clear nasal passage. Labeling of the viral transport medium tube should be in advance with the name, civil ID number, date, and time of collection. Seat the patient in comfortable bed or chair in high volar position with the back of the head supported. Ask the patient to clench her or her eyes to reduce any sneezing attempt. When you introduce the swab, although it's very delicate and thin, much higher. So this is the tube capped and labeled, and the inside the viral transport medium, you can see it. The lower down is the nasopharyngeal swab, and you can see the breaking point. This red point is the point where you should break the swab when you insert it inside the viral transport medium. You should put the patient either flat, supine on the bed, or you put them on Fowler's position. The lower, the picture down, this is Fowler's position, and the one up is semi-polar. So if he's supine on bed but is uncomfortable to be supine, you elevate the head of the bed to be in Fowler position, and the most important thing is the head should be supported. So if you are in a situation that the patient was on a chair, try to support his head with your hand, or you put him on the wall. So when he cannot move a lot, and when you introduce this, they tend to go back. So only make sure that the head is supported and he cannot move. Sometimes, if the situation is bad, you can ask someone else to hold the patient's head and assist you. Step 4, enter flexible swab several centimeters, which is 5 to 6 centimeters, about 2 inches, with a slow, steady motion along the floor of the nose until the nasopharynx is reached posteriorly. Approximation of the distance from here to the nasopharynx is the same distance between the nostril and the opening of the ear. It's the same, approximately same distance. So before you insert the swab, you just approximate this distance you will insert by looking at the patient's distance, and then you put your hand on the same distance. You hold the swab on the other end, the same distance. So when you reach it, you reach this distance, and at the same time you meet a resistance. Then you are sure you are in the nasopharynx. So second step, when resistance is met, rotate the swab gently and leave it in place a few seconds, like 5 to 10 seconds maximum. Carefully remove the swab without touching the sides of the nostril. We don't want to contaminate it with anything else. You just remove it without touching anything. Open the transport vial and place the swab in the transport medium, and break the swab at this cord line and recap it. Shift to red line is the break point. Why our target position of the nasopharyngeal swab is the nasopharynx? Why? Because if you notice, on the anterior nostril where we have the vestibule anteriorly is covered by skin. There is no respiratory epithelium, and the most concentrated part in the nose that contains the respiratory epithelium, that where the virus usually enters the body and grows, is the nasopharynx. Nasopharynx is this one. This is the nasopharynx. This is where we want to reach. Okay. So swab, path of the swab should be like this, all the way parallel to the palate and perpendicular on the face, and parallel on the palate, all the way back to the nasopharynx. Technically, it's when you go blindly, even when you go with the scope, it's little bit difficult for if you are not expert in the nose anatomy. And usually, your hand tends to go up when you insert the swab. Your hands tend to go up, and you will falsely take the sample from here or here, because you will meet a resistance and you will reach the same distance. So you will think you took it from the nasopharynx, but usually they are taking it from the middle meatus. Okay, so I will revise some anatomy just to make sure you can understand how you can do it, and it will be much clearer. Nostrils. Each nostril leads to a separate nasal cavity. So, the nasal cavities, the two nasal cavities, are separated by this, which is called the nasal septum. This is the nasal septum, and this is one nasal cavity, and this is the other nasal cavity. The whole thing, this is the nasal cavity. The nostrils are so small, but when you go in, the cavity is much bigger and larger. And the swab might go up or might go down, and we don't want this to happen. We want it to go on the palate straight, parallel to the palate, and perpendicular to the patient's face. Okay, so both these nasal cavities, the left and right nasal cavity, both they lead to the nasopharynx. So wherever you go, left or right, they will reach the same area posteriorly, which is the nasopharynx. If you insert it right and you face an obstruction, you cannot go further. You go and try the left, because usually, most of the people they have deviated nasal septum, or they have enlarged turbinates. These three shelves you see, 1, 2, and 3, these are called the turbinates. They composed of bone and covered by mucosa. And they have an opening below it, which is called the meatus. So we have 3 turbinates, inferior, middle, and superior, in both the nasal cavities. We want to bypass them and go posteriorly, so we will go below the medial inferior turbinate, this one, and on the palate here, closer to the septum. So you should aim to be here, exactly here, on the palate. This is the palate, and this is the nasal septum, and this is the turbinate. You should be away from the turbinate here, closer to the septum, and on the floor. You go all the way back, the distance which is from the nostril to the ear. To be more clear, I will show you this nasal endoscope. This is the septum, and this is the turbinate on the other side. This is the septum, and this is the turbinate. We're going near to the septum, all the way back, and this is the nasopharynx is reached. So try your best when you go with the swab in, try to push the tip all the way down, because your hand tends to go up. So always push it down, down, down. Put an effort to push it down, always. Do you want me to repeat the video? again the video. So this is here again. This is septum and turbinate, and we're going all the way back to the nasopharynx. As I mentioned earlier, tend to go up, like the picture down there. The hands always tend to go up. You feel that you're going down, but it's always go up. So always put an effort and push the tip down while you're going in. So you push down, always push down and forward till you reach the resistance and the distance. So two things, the distance and the resistance. When you reach the distance you saw on the patient, and when you reach the resistance, this is it. This is the nasopharynx. So stay for a while, 5 seconds to 10 seconds, and slowly rotate it. So the swab will take as much as cell as it when you rotate, and then go out. If you go up like this picture, the picture down, it will go to this area. It will go up to this area, and you will face resistance. This is the middle meatus below the middle turbinate, and you will get some cells, but the sensitivity is much lower than the nasopharynx. هذا فيديو إن شاء الله يطلع صوته.
COVID-19 diagnostics. Nasopharyngeal swab. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. Among other things, the examiner should wear an N95 respirator mask, gown, protective goggles, and gloves. To save resources, we will refrain from using each of these items in this video, and instead only show the technical details of sample collection. Let's begin with the nasopharyngeal swab. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt the patient's head back slightly and support it with your non-dominant hand. If necessary, lean the patient's head against a wall to minimize jerky movements. Stand slightly offset from the patient to avoid the risk of contamination in case of a sudden cough or sneeze. Be sure to advise the patient of potential discomfort during sample collection and let the patient know that they are welcome to close their eyes. Sample collection should only be completed using sterile swabs made from artificial cotton with flexible plastic shafts. Calcium alginate swabs or swabs with wooden shafts must not be used. These materials can inactivate viral particles or inhibit PCR tests. Furthermore, wooden shafts are more likely to cause patient injury. Hold the swab like a pen between the thumb, index, and middle fingers. Maintain a loose grip that allows the swab to accommodate any resistance encountered during sample collection to reduce the risk of injury. Avoid using the following hand position during sample collection. Start by inserting the swab horizontally into the left or right nostril. Carefully advance the swab while maintaining a course that is close to both the septum and the floor of the nose, parallel to the palate. Do not advance the swab upwards, but instead straight back until resistance transport media. If a nasopharyngeal swab cannot be collected for any reason, an oropharyngeal sample can be also collected through the mouth. Again, inform the patient that this smear will feel uncomfortable for a short time and may trigger a gag reflex. Ask the patient to open their mouth wide, protrude their tongue forward, and say ah. Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity without touching the lips, teeth, tongue, hard palate, or soft palate. These surfaces should be avoided as they are often colonized by a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall. Just as with the nasopharyngeal swab, The oropharyngeal swab should now be placed into the sample collection tube and sent to the laboratory as quickly as possible.
Okay, thank you. هذا التيوب اللي نستخدمه بالكويت عليه الليبلينج انفورميشن كلهم وداخله هذا الفيرال ترانسبورت ميديوم وكابت. طبعا السيتنج اللي before the nurses know all about it, how to sterile the table and insert things, everything, and wear your PPEs, full PPE, face shield and mask and everything. And you put the patient, usually the patient may be in the hospital laying flat on the bed. If they are comfortable laying flat, you take the sample while they are supine. And if they are comfortable, they cannot lay flat, they have respiratory distress or anything, they put them in foil position, and the head has to be supported. If you see the swab is really delicate and thin and easy to maneuver, and it has this breaking point. It's very easy. I'll show you how to break it. First thing, you have to take cotton sheets. Oops. Take a cotton sheet and put it on the patient. So if anything sprays or anything, it will not contaminate the clothes. Then you should not stand in front of the patient in any situation, because if he sneezes or anything, it will be on you. So always be on the side of the patient and ask him to sneeze. Can you please sneeze and clear your nose? Then, Dr. Abanar, I'm going to take a sample from your nose. It might be a little uncomfortable, but you just bear it for a few seconds. And I'm Dr. Nisreen. It will be simple and easy, but you just bear it a little bit, okay? Always support your head. I'll take it from here. You go all the way. Always push the tip down. Always push it down. When you go, always push it down till you reach the resistance. Then you rotate it. Leave it 5 to 10 seconds. I am on the nasopharynx now. Just rotate it and then take it out. If you see, it has little delicate hair that can take little cells from the nasopharynx. And if you see, we go all the way till here. And if you see, there is the distance. It is exactly from the nostril to the ear. So there is a lot of cells. I can see it here. Okay. Put it in and break it. It is easy to break. أنا بس very easy to break, and cap it. That's it. And you put it in the bag to be transported to the lab. How do you feel now?
It's a little discomfort, but it will go. Within hours it will go.
Okay.
Yeah.
That's it. Any question?